Quickly, I want to share with us the vision of FOHA, and we are aiming at a society where healthcare is accessible to everybody. That is our vision statement, that the society where healthcare is accessible to everybody. You know, it's not easy when people who are in the hinterland, who do not even have access to road, getting access to healthcare. So what we aim at is to reach out to the villages, to the places where they do not even have a nurse, so that they will be able to have access to this medical screening or health education in order to prevent most of the diseases that are preventable, especially diabetes and hypertension. And we talk about our mission statement. We are a reputable health organization that provide public health services and clinical health screening to children, women, and the aged. So our target group is children, women, and the aged. We do public health services by way of the education we give to people on radio, in churches, in the various communities, in order for people to live a healthier life. Quickly, I just want to share with us our objective. Why do we exist? One of the reasons why Friends of Health Association exists is to reduce maternal and infant mortality rate to the barest minimum. And we do this by way of education. And number two, to build the capacity of members through leadership training. We have trained a lot of members. Personally, I'm a professional nurse. I've also been trained as a monitoring and evaluation officer. I've been trained also in the strategic management, organizational management, and we also do workshops for our members. So though they are nurses and doctors, but we try to build their capacity, you know, in order to help develop our communities and to make life better. Prevent diseases and their complications through public health. Like I mentioned earlier on, the education that we give is aiming at, you know, preventing diseases and complications. We do HIV campaign, we do education on diabetes, we do education on hepatitis, education on malaria, and all is aiming at preventing complications. Because over here in Ghana and in Africa, we wait for diseases to, you know, come before people start to put in measures. But we are aiming at preventing the diseases and their complications. The last one, to support people in the community socially and economically. What we do is that we contribute actually our quota to support people. Sometimes we see people in the hospital, they do not even have money to buy food, much less to even buy drugs. So we contribute our little resources to support them. And we also support orphans and widows. And I think every year, we started last year, organized Christmas party for orphans. And we did it this particular year. That was on January 4th. So if we talk about Friends of Health Association, this is what we are actually doing. And our future plan is to actually make sure that we get down to places where there are no clinics set up, you know, at least mobile clinics where people can get access to us. And it is surprising to hear that one of the areas in Bekum, one of the chiefs has given us 4 plots of land, and we are actually working on a clinic project.